Marlene, you just gave a great talk about something that's very exciting, that after many years of people developing things to try to measure the intraocular pressure in the eye on a 24-hour basis, and some of these things could only do it for 24 hours, and they required a contact lens, and some things required something in an intraocular lens. Now there's something that looks like it really would give 24-hour monitoring, and it's much less invasive and may not have the side effects of the others. Tell me about this new thing that you're actually using in an FDA trial. What can you say? What are you allowed to say about it at this point?
Well, I do believe that this is very, very new in its infancy, not quite ready for FDA trial. However, it is the wave of the future. To be able to monitor intraocular pressure in our patients who have glaucoma and understand how pressure is variable at night, how it relates to exercise, how the pressure relates to medication use, whether we're using the right medicines in the right patients, and perhaps what the real results are when we do intraocular surgeries. Does the pressure come down all the time? Does it come down just some of the time? And is it sufficiently low to ward off recurrent visual field loss and optic nerve damage? So this new device, this sensor, will likely change forms many times until we get it right.
And it's really nanotechnology. It's very small.
It's very, very small. The goal is to fit it into the anterior chamber of a mouse, which is 1/10 the volume of a drop, and therefore we need to be able to reduce the size so that it is compatible with the eye and not cause inflammation, not cause any negative effects, any erosions, any issues. So ultimately it can be placed in the capsular bag. Perhaps it will be in the bottom of the anterior chamber, ultimately injected via a needle or a cannula.
At the slit lamp.
At the slit lamp,
Wow.
which is great for you. So there are many, many possibilities, some which will come to fruition, some which won't. But the idea of pushing forward to know really what's going on inside the eye is just a huge advance compared to what we have now.
And you might also find that it might correlate with water intake or something. Make Hemosazana really happy to be able to know how this actually impacts people in their life as they live it.
That's exactly right. What happens during a basketball game? Exercise, yoga, standing upside down. Should we really be telling people to limit their exercise or not? What happens during a wind instrument, for example, a trumpet player? What happens to people who, as you mentioned, drink a liter or two of water at one time? This is all so new and exciting that we will be able to make educated recommendations to patients based on what the data shows.
Well, we'll certainly be watching this space.
Yes, we will. Thank you, doctor.
Thank you.